Welcome to the Leukemia and Lymphoma Society of Canada's workshop for caregivers to adults with an acute leukemia. Today, Donna Thompson will identify the ways in which you can advocate for your loved one as a caregiver in the complex healthcare system we are navigating today. Allow me to introduce myself. My name is Alexandra, and I am the Community Services Manager for the Western Region of Ontario here at the LLSC. I will be the host of today's online education session. At the LLSC, our mission is to cure blood cancers and improve the quality of life of those touched by a blood cancer and their families. We offer guidance and support every step of the way. Our community services managers are here every step of the way. We are here to provide personalized, one-on-one support related to your experience supporting a loved one with a blood cancer. Connect with your local community services manager in the region for your support, resources, or help navigating the healthcare system. If you have specific questions regarding your loved one's diagnosis, please contact your local CSM for more information. Last November, we launched our brand new website, bloodcancers.ca. The website was designed with you in mind to ensure easy and personalized navigation no matter your current circumstances. For example, if you are a caregiver to somebody with a blood cancer, you can choose I care for someone with a blood cancer link at the top left hand of the page. There, you can choose information based on what you are experiencing or would like help with as a caregiver. The pages are designed to provide you with easy access to services and valuable information in various formats. Here are some examples of education resources and support services you can find on our website. You can access free booklets and fact sheets containing information about specific blood cancers, treatments, and practical information. You can also find animated educational videos, past webcast reportings, as well as access to all of our podcasts. We know that managing side effects is an important part of cancer care. This is our LLS Health Manager app, which is free for download in the App Store. On the slide, you will see a list of tools that are accessible to patients through their smartphone. By tracking your loved one's medication, side effects, food and hydration intake using the Health Manager, you can export your information in a calendar format and share it with your doctor to identify patterns and develop strategies to help manage your loved one's side effects. The app also features shared caregiver access, which means you and your loved one can have access to the information in this app. In other words, all of these helpful resources are right in your pocket. Our peer support program is a support service that matches people affected by a blood cancer, caregivers and their families, with trained volunteers who have been touched firsthand by a blood cancer and share similar experiences. Whenever possible, participants and volunteers are matched based on their age, gender, and diagnosis, or the issue that is most concerning to them. We are also currently looking for caregiver volunteers for our program to assist others. If you are interested in this opportunity, please connect with the Community Services Manager in your region to learn more. It is my pleasure to introduce our speaker today, Donna Thompson. Donna is a caregiver, author, and activist. Her caregiving experience was shaped by caring for her son, who has severe disabilities with medical complexity, and for her mother, who lived with dementia until she passed away in the summer of 2018 at the age of 96. Donna is the co-author of The Unexpected Journey of Caring, The Transformation of Loved One to Caregiver, and the author of The Four Walls of My Freedom, Lessons I've Learned from a Life of Caregiving. She is a co-designer and co-instructor of the Family Engagement in Research course and facilitator of the Caregiving Essentials course, both at McMaster University. Thank you so much for being here today, Donna.
Thank you so much, Alexandra. I'm just thrilled to be here with you and with caregivers from the LLSC. So today I'm going to be talking about and reflecting on advocacy in family caregiving. And, you know, the first thing that I thought of when I was preparing for this presentation was to try to find a good definition of advocacy. So what are we really talking about? There's quite a bit online about health advocacy, but health advocacy and its definitions really are talking about what medical professionals do to advocate for their patients. So let's look at that definition first. In the medical profession, health advocacy means activities related to ensuring access to care, navigating the system, which is often very complex, mobilizing resources, so getting help, addressing health inequities, and influencing health policy and creating system change. Next slide. We do all of the things to advocate for our loved ones that health professionals do. So in looking at that health professional definition of advocacy, I'm sure that you're thinking, well, I do that. I do a lot of that stuff. And we do, but we do more too. We do a kind of role in advocacy that puts us as responsible people to translate the patient's lived experience to medical professionals, to family members, to friends, to neighbors. We also act as brokers. In other words, we're always introducing and reintroducing our loved one in the context of blood cancers. You know, there is a disease progression. You get better, you get sick again. There is this ongoing back and forth of illness and wellness, and periods of waiting for treatments in between. So wherever the person is in their treatment journey with blood cancer, your role as a family caregiver advocate is going to be a little bit different. And it's a constantly sort of explaining, how is the person I'm caring for? How are they doing? What do they want to do today? Do they want to see friends? All of this kind of translator role is part of family caregiver advocacy. Next slide. So I thought about, what is one piece of advice that I would begin with in terms of what I have learned and what I often tell other caregivers in terms of my one best piece of advice. And that would be to think about what you need instead of thinking about what a particular service or person or institution or organization has to offer. And that sounds simple, but it's actually kind of complicated to try to think about what you need. You know, I'll tell you just a story. I remember when I first was applying for our son, who, as Alexandra mentioned at the beginning, is very medically complex. He requires 24-hour one-to-one total care. And when he was small, I was applying to the government for the first time for some help. And it was a direct funding program where they would give you some money to help you in the family get whatever you need in the way of home help or cleaning lady or anything that you need. So I remember a friend of mine who was my caregiver mentor was helping me fill out the application form for this funding. And I said, well, what do they have? Like, I'll apply for the maximum of whatever I'm allowed to, which I think at that time was $3,500 a year, which isn't very much for a child who required 24-hour awake nursing care. And so my friend said, don't ask for the maximum, ask for, I don't know, $30,000. And I said, is that allowed? can I do that? And she said, well, that's actually what you need. So put that down. And I did. There's nothing stopping us from considering and asking for what we really do need, as opposed to thinking in boxes all the time about what actually is on offer, which frequently is, maybe it is enough to meet our needs. Maybe an organization or a medical service is offering more than we need, but sometimes it's really not enough. And that's where we need to think, okay, this is what I need. This is what I really need. And that's my one piece of advice. And the way you can begin to think about this is just by filling in the rest of the sentence. Things would be so much better if only I had or we had, and fill in the blank. Next slide. So in advocating for your loved one, a lot of times in the case of blood cancer or other progressive diseases or acute serious illness, family caregivers need to advocate to medical professionals, to case managers, to social workers, and even to extended family in order to get the kind of support that we're going to need at home, in the hospital, in other long-term care settings, maybe. Whatever it is, whatever the health setting is, we are often advocating to many different people for many different things. And these advocacy efforts can be very, I'm going to say, desperate. Sometimes it can feel life and death for what you're advocating for. So one thing that can be very helpful is understanding some basic principles of how to influence people and get them to do what you want them to do. And the first idea along these lines that I want to talk about today is this process of strategic inquiry. Often when we're advocating, we think that we need to be combative, we need to be very direct and strong, and we need to tell people in no uncertain terms what we want. That's true in some cases, but in my experience, and what I would say is that all of my huge wins in health advocacy personally have come from and as a result of this process of strategic inquiry, which is really a process of gathering information and building relationships with people who have the power to say yes to you, seek their advice, get them to be your champion. And so this all happens before you ask for what it is that you need. Next slide. So some of the questions for strategic inquiry are what do I need to know about this issue? So take, for example, hypothetically, a case where you might want to be advocating to be in a research study or to get access to a type of treatment that is not mainstream. Or you might need to advocate to see a specialist that you're not currently connected to. So think about those kinds of problems or challenges in advocacy as you look through this list of questions. So you will want to know, what do I need to know about this issue in order to understand the position of people who might be telling you, no, you're not eligible for this. The answer is no. So, or If you're not sure even who to ask at the beginning, you want to get some information to make sure that you're asking the right person. So who's involved in decision making on the issue that is relevant to me? Essentially, who's the person who can say yes to what I need? What are time frames that are important? So, for example, in research studies, if you want to be a participant in an experimental treatment program, for example, you're going to need you're going to need to know what time frames are relevant. When does the study end? Are you recruiting for this study now? When does recruitment close? And, has anybody else had success at getting the same thing that I'm asking for, the same thing that my, loved one and my family needs? The peer community in family caregiving, including in blood cancers, is so generous and so wise. And the peer-to-peer community has tons of information about, oh, I know someone who did get what you need, and this is how they did it. There's a lot of that informal sharing going on all the time, as you know, if you're part of a caregiver support community. And then, of course, who else should I be speaking with? This is the aspect of asking for advice, which pretty much automatically makes friends with people. It sets you up as an ally, not an enemy, not someone who's, oh no, here comes the person who's going to hold me captive in conversation for the next half hour. This is about making friends and influencing people, getting them on your side. And one good way to do that is to ask their advice. Next slide. So as you're acting as an advocate for your loved one, the patient, you have lots of roles in this respect. One of those roles as a patient advocate is to interpret information. You're constantly interpreting and assessing information. You're looking at your loved one's symptoms, you're recording them, you're trying to make sense of all of these things, what's happening in your home with your loved one, the patient. And you're also trying to translate that information to healthcare professionals. So that's a huge role in advocacy. That is a responsibility of the family caregiver often, particularly if the person is too ill to perform that role, him or herself. So you're the history keeper. You are the corporate memory of your loved one. And often it's so important to report what are their preferences? What were they like before they had this diagnosis? What are their dreams for the future living with the illness? So this is that kind of information sharing and information kind of coordination, making sure that everybody in the circle of care has the same information so that when it comes to medical decision making, you can all be on the same page. Again, that's a huge role of the family caregiver, because the physicians, each one of the medical professionals in the circle of care, are not necessarily going to be talking to each other, as we know. And so oftentimes it's the role of the family caregiver to do that information sharing and make sure everyone is on the same page. Again, that's a big role in advocacy. Maybe you didn't think of that as advocacy before, but it is. Again, it's setting yourself up for success. And, as the person who is doing the online research about new treatments, about information, about who are your resources, I heard someone say that caregivers are better researchers than online researchers than the CIA. And it's true. We, in every waking moment, I'm sure that you're on Google looking up side effects. What is the new research? What does this mean? We've just had a new diagnosis. What does it mean? And trying to read the tea leaves for the future. In terms of advocating around medications and side effects, interactions, etc., it is important to know who your allies are. And one of those allies in the community and at the hospital is the pharmacist. We so often forget about the pharmacist as being an important caregiver ally, and they are. So if you are beginning, I would suggest that as soon as you have a diagnosis and you begin to have prescriptions filled in the community at your local pharmacy, request a consultation with the pharmacist, explain the situation, have a look at the medication profile, and gather some information right then and there. But the real purpose of that meeting, besides information gathering, is putting names to faces and getting to know your pharmacist. And just saying, you're going to be my ally, and can I call you anytime? And I'm so glad that to meet you and to know that you have our backs out here at home with new medications all the time. The medications that are prescribed on day one of a diagnosis are not going to be the same ones often in 6 months' time. So, and familiarizing yourself with new procedures using this process of strategic inquiry. And, in terms of everything that you need to know in order to make treatment decisions with your loved one moving through blood cancer, you're going to need to do that research. All of this comes under the broad umbrella of patient advocacy. Next slide. And, managing emotions throughout these processes of advocating to get what you need through a serious illness. As I always think of it, I call this mad with worry. Often we are mad with worry. We're just crazy worried because it feels so threatening, life-threatening to be in a position of desperation when, particularly if you feel suddenly unable to advocate effectively. We feel helpless, hopeless, desperate. And when those moments come upon us, and they will, managing emotions is very difficult. And our worry can look like anger. And, that's one of the reasons that if you go in the hospital and you see in the emergency room signs up that say, abuse of staff will not be tolerated. I don't know if you've ever seen those signs, but they're in almost every emergency room that I've been in. And I wish they would change those signs, take them down, and put up something that said, we know you're probably having the worst day of your life if you're here. And coffee machines are down the hall. Feel free, if symptoms change in the waiting room, feel free to alert us immediately. I wish they just had people there to calm the nerves of patients and families in these very, very difficult situations. In any case, this slide isn't here to make you think that you shouldn't look angry when you're feeling desperately worried. I think it's just good to know that sometimes that's the way it comes across. And it's not to say that we need to change that, but if you are able in the moment to check yourself and instead say to the person in front of you, maybe that's the triage nurse, an emerger, someone else that you're speaking with in that moment, say, you know, I feel desperate, I feel helpless, and name your feelings and say, is there anything you can do to help me? Because we need action here, and name the action. So to the extent that you can do that, it's so much the better, but forgive yourself in these moments and just be aware that sometimes emotions in those moments can look like anger, and that may be one reason that it can be very difficult to get what you need in those moments of real desperation. Next slide. So convincing others, you know, this begins also with curating the stories we tell to whomever it is that we're advocating to. So choose, if you're going to go down the route of advocating for something for your loved one, I would say choose one story that is short and really demonstrates what happened at home or what happened in hospital, that shows in no uncertain terms why you need what you need. So sometimes we're not that planful, I'm going to say, about the stories we tell. But the more you can be strategic about choosing one story to demonstrate a problem, then that's going to exponentially increase your chances of success. So what I'm talking about here is really an elevator speech to demonstrate need. So you can even take a pencil and paper and write down what your story is. And sometimes I have to admit, I've put two stories together to make one super powerful story. And again, it shouldn't be too long, should be very short, but it could begin with something like, you know, doctor, I need to speak to you because I really need to ask you for help. What happened this morning scared me, and this is what happened. Something like that. Introduce a short story that demonstrates clearly why you need what you need. Next slide. And, you know, in terms of advocacy, so far today, we've been talking about caregiver advocacy for the patient. But we know perfectly well, all of us know very well, that everyone in the family, their well-being is dependent on the other. So if somebody in the family is not doing well, everybody doesn't do well. And we need to be, through the course of a serious illness like blood cancer, we need to be the best we can be given the givens of the illness. And that goes for everybody. So I'm not going to talk about self-care here, but I'm going to talk about acknowledging that everyone in the family, including the caregiver, has needs related to personal well-being. And we need to think about each other and how we can support each other in the family moving through an illness. So one of the fantastic tools that I found to do this is called the F words. Now, this F words template was originally designed by childhood disability researchers at McMaster University. But it is based on the Human International Classification for Functioning at the World Health Organization. So these are the domains of human functioning. And the two researchers at McMaster translated that very medical jargony international classification of function into this simple framework called the F words. And I present this to family caregivers of all ages, across disease groups, across diagnoses, because I think it's so relevant to everyone. And the F words are functioning, which would be like work or purposeful action in your life, family, fitness, fun, friends, and future. And the idea here is that everyone in the family, just, you could print this off on your printer and put down words that represent what's most important to each member of your family in each of these F word domains. So even future, like what do you want to do later today? What do you want to do tomorrow? If you're looking at time frames that are very short because of windows of wellness for your loved one, that's fine. This is going to be very, very personal for you, and it's going to change as the course of illness changes and reduces or increases capabilities. So that's why it's so handy. Everybody can participate. And and then everybody can look at each other's and say, how can I help you reach your goals? And the patient is going to want to be helpful to the caregiver, to other children in the family, other people who are close, in comparing each other's F words goals. It sort of levels the playing field and enables everyone to contribute to the well-being of each other. Because sometimes when there's someone with a critical illness, it's very easy for all other members of the family to have their well-being goals sort of subsumed by the patient, and that's not good for the patient either. So next slide. The other tool I wanted to present today is something called the Care Map. And the URL for this, where all of the instructions appear, to make with pencil and paper, so easy to do, so revealing, is atlasofcaregiving.com. Look for tools, and then go to mapping ourselves, care mapping. And the instructions will be there. So it's very simple. You just draw an image of a house with your family in it. That's the family. Then who else is implicated in your lives right now, who may be medical professional, who may be a neighbor, sister, brother, children who live in a different city, pets, everyone in your life who is important. You just draw them, and the instructions will tell you how to represent those relationships. And then it offers a series of prompt questions to help you consider what your care map means. And next slide. You can just quickly look at some of these questions, but the first one is a good one. Who is indispensable here in the circle of care, and what happens when they're not available? What happens when the caregiver gets sick? Who could be replaced? Who is irreplaceable? This is a planning tool and a tool for understanding what you already have. Because sometimes it's shocking. You think, yeah, wow, I do have a lot of care and support. And also, what do I need? What are the holes? How can I fill in what it is that I don't have currently? what can I change in my care map? It's just extremely helpful to visualize your life because it's so changed with the presence of blood cancer diagnosis. People in your inner circle will be different than they were before that diagnosis. So it can feel like, oh my gosh, it's chaos. And I don't really know, like, I don't understand why our old friends aren't coming around. But who is there now? And and if there's people missing, what can you do about it? So one of the things I did when I made a care map was I showed it to our GP. And of course I showed it to my husband. We talked about it. So these are tools that are very handy advocacy tools to help you, to help demonstrate what your needs and your wants and your preferences are in terms of support. Next slide. Yeah, these are just a couple more questions. How has your care map changed over time? So this is, again, a tool that you want to do once in a while as the situation changes and new and different people come into your life and your circle of care. And in order to better understand and make sure that everyone knows about each other, the care map is a good tool for that. Next slide. And then it's also helpful for thinking about matching needs to resources. So, it's, as you know, when treatments, side effects are really, really kicking in, the disease is just taking a bite out of your patient and your whole family, you're going to need more help at home, and you need to look to the community for that. So this is just about kind of a brainstorming exercise about what your needs are and what are some resources that might be helpful for you to ask. Where do you go for help? So let's look at, this was a paper that I did for myself when our son was in the ICU. I thought, oh gosh, we need help with yard work and dog walking, and we're going to need, and at the same time I was looking after my mother, and we needed more personal support workers for her. So you can see the resources that I sort of dreamt up that where I might be able to get help. Yard work, I called the local high school and I said, this high school students need to perform volunteer work in order to be able to graduate. Can I get a volunteer high school student from my local high school to cut our grass? And I did. Yeah, I was able to do that. So that's one idea. Schools in your local community, even if you want maybe a student just to come keep company or help with computer skills or whatever it is that you think you might need. Community center, our local community center was really, really great. I used to be on the board of it. And because it's about wellness in the family, all generations, all ages, all abilities, and they have a great outreach program for families who are more shut in due to illness or disability or whatever. So I did go to my community center and my church. All of these are possible sources of help and possible sources that you can advocate to. Next slide. And bridging the gaps, online, we need to organize ourselves in navigating complex systems, in navigating and coordinating a circle of care. And we need to do that bridges healthcare settings. So we need to, how do we translate your loved one's life and needs and care situation moving home from hospital, moving back to the hospital, moving into the community. It's really complicated, and online sources can really help for that. So Alexandra has already mentioned the LLSC Health Manager app. That's a fantastic tool for just keeping track of medications and side effects and being able to share that very efficiently with healthcare providers and clinicians. But also, next slide, there are, other people who can be coordinated in the circle of care as well. So here's just an example of people who may be involved in your life. And the big challenge is putting everybody in one room so that you don't have to have individual conversations all the time with people, and then think, oh, I really need to tell everybody this, but did I remember to tell the nurse? And it's so easy to get mixed up. I remember telling somebody, but I don't remember if it was the nursing assistant, a volunteer, some of the home. Who did I tell? So next slide. A solution for that. There are solutions for that. And one of them that we use in our family is called Ties Personal Networks. It's free online tool, completely secure. It uses bank grade security. So we have our will and end of life directives for our son in a file in Ties. Our GP has agreed to be a member of it, and all of the nursing staff who currently care for our son. Our son moved out of home at age 23, and he lives in a medical group home now. So his nursing staff are here, and there's so many people involved that we needed to bring everybody together online, but it needed to be very secure because medical information is shared and stored. So that's one way, but if you want to be more informal and just kind of coordinate family visits, for example, you can do that with other tools such as Lots of Helping Hands, Caring Bridge. There are lots of them. If you just Google Care Coordination Online Tool, you'll find lots of them. Even just a shared Google Calendar is many people use very efficiently to make sure that everybody knows what each other's doing, and everybody, not everyone shows up on the same day at the same time. So next slide. And finally, if you really don't want to be an advocate because you feel very uncomfortable asking for help, the thing is, then you can identify someone in your family or a close friend to be the advocate for you. Let them have that role in trying to conducting the strategic inquiry and keeping you in the loop and doing the actual work of asking for help for you. But I think that someone in the inner crew of caregiving needs to take this role. It's not going to be good. It's going to be very challenging if you try to move through this diagnosis without anyone in the role of advocate. It's just a sort of sad fact that somebody needs to do it in today's world, because we need to try to get a personalized, best standard of care for our loved one that we possibly can. That's our challenge as family caregivers. So thank you very much. It's been a pleasure to speak with everyone today.
Thank you so much, Donna, for being here today to share your tips and expertise on advocacy with us. We hope you all enjoyed this presentation as well. We would also like to thank AbbVie for making this presentation possible today. I would like to remind everyone that we are here for you. Do not hesitate to contact the LLSC if you need more information or support. You can reach us by email at info@bloodcancers.ca or toll free at 1-833-222-4884. Also, make sure to check our website, bloodcancers.ca, to learn more about our upcoming webcasts, podcasts, and special events. Thank you again, all of you, for being here today, and we hope you have a wonderful rest of your day.